That's a very good question. As we move forward, the degree of contact tracing will be reduced little by little, and we're already slowly reducing the amount of contact tracing we are doing. It will be a gradual process. So we're still releasing those sites at the moment, but the numbers will be decreasing as time goes by.
What's going to happen with that? There's now 300 health staff in quarantine. What's going to happen with that health services as more and more health workers are in isolation?
The healthcare services, I mean, we always have a certain percentage of the staff who are sick and away from work. All the healthcare services are functioning well and have plans to deal with this. So at the moment, we have no issues. I mean, obviously, it is one of the things that will put a strain on hospitals. There's no question about that. But all healthcare services have plans and they are managing well.
In terms of those 7 people that are in hospital, can you talk us through what level of symptoms they're
suffering? Yeah, I can a little. Mostly the symptoms are not particularly severe, interestingly. We've seen, and I've spoken to Kerry Chant about this, we've seen some people with some abdominal symptoms, interestingly. Diarrhea and dehydration is one of the things that we've seen more than severe respiratory disease. But can I actually, there is one thing I really do have to emphasise here, and this actually is very important. 3/4 of the patients that we have seen in Queensland to date, in the last 2 weeks with COVID-19, have been under the age of 35. So under the age of 35. So it's a young cohort. We haven't seen a lot of older people with the infection at this stage, and hopefully the older group are getting their 3rd dose of the vaccine as we speak. And I think we've seen those with the numbers that every day we're seeing large numbers of the more vulnerable coming forward. So at the moment, it's a bit hard to draw too much of a conclusion. And I probably don't want to overstate this issue of these patients not having a lot of unwell patients, because these are young. 3/4 are under the age of 35. And there's one other important point that cannot be overemphasised. That is, even if there is a small percentage of people with COVID-19 who get seriously ill, when we get very large numbers of patients with the infection, which we inevitably will in the coming weeks, this will put a strain on health services. There's no question about that. We know that. We have plans in place, but it will put a strain on services. Even just a small percentage of a very large number is still a large number. We haven't seen it yet, but we're expecting it and we're planning for it.
Are you putting those patients that are turning up having less vaccination than some of the older patients? Is that what you're explaining? That the older patients may, or the other people who may not have received COVID or be treated for COVID have had their 3rd shot? And so the under 35.
What I'm saying is that's 3/4 of the patients that we've seen diagnosed in the last 2 weeks, they're under the age of 35. It's probably related to the behaviour of young people. They're more social than people who are over the age of 35. So we've known that from the beginning, that younger people are more likely to get this infection, even though they tend not to get as sick. Maybe I didn't make that clear. So they tend not to get that sick. So I don't want to overemphasise the fact that we don't have anyone in intensive care. It's interesting and we're watching it with great interest, but our age group is young.